Good afternoon. Happy Tuesday. We thank the governor for all he's doing. He just wrapped up his remarks. Can everyone hear me? All right. Okay. Mayor President Guillory would like to be here, but he's out currently working, trying to secure some more materials for our screening site, and just making sure we have enough materials moving forward. An update on the screening site today: 133 people showed up. 43 were screened out. I mean, repeat that: 133 people showed up. 43 were screened out, and 91 of those were tested. We'd like to remind the public that if you come through the site, please leave your pets at home. Some of those dogs can get a little aggressive when the swabbing is taking place, and we've had a few experiences with that. So if you would leave your pets home, it'd be greatly appreciated. Also, you will not be able to get screened without an ID. It's needed so the results can be reported as mandated by the federal government. So please don't forget your ID. Some numbers for 311 today. We had, well, yesterday rather, 24 hours before. 459 total calls. 79 of those, let me repeat that, 459 total calls. 79 were triaged to the Cajun Dome. 7 were triaged to urgent care. 29 of those triaged to primary care providers. 9 of those were triaged to emergency rooms. 2 were triaged for home care, and 26 of those callers just received general information. All right, before we move forward, I want to invite Charles Lagrange here. He's from Republic Services, and he does have some information for residents who do have Republic as their garbage provider, and he's just going to give you a few comments. He does not have time for questions, so if you could refrain from asking.
Thank you, Jamie. Good afternoon. I want to thank the Mayor President for inviting us to this briefing this afternoon. Just a couple of quick things. With more folks staying at home, with more businesses closed or having reduced schedules, we are seeing an increase in the amount of waste generated at the home. So with that being said, we want to remind customers to please, at all costs, bag your waste. Avoid putting loose items in the garbage, and try not to overload the container. Make sure that that container can completely close. This will help us out, especially during times of collection, to avoid any issues related to litter or any additional spillage. In addition, we want to let customers know that due to these increased volumes, the times for collection could be delayed in some instances, just simply because of the volume. So we want to remind customers that you can anticipate that as part of this process we're going through with the pandemic. But other than that, we're going to continue to monitor everything daily. We are in constant communication with our partners in the Mayor President's Office, Public Works, parish and city councils, and like everyone else, I'm sure that we would like to see a quick end to this pandemic and back to business as usual. Thank you.
All right. Donations of PPE. Masks, gloves, gowns, face shields, those are still being accepted. You can drop them off at the Cajun Dome screening site tomorrow from 8:30 a.m. to 10:30 a.m. The United Way warehouse will also be collecting PPE, including homemade masks, from 8 until noon at 215 East Pinhook Road. It's always windy out here lately. You can also drop off homemade masks here at the LCG building at 705 West University. We're collecting those for some of our employees like LUS, the folks who have to be outdoors or maybe servicing people's homes. We'd like to get them some masks, so we are accepting homemade masks here. When it's less windy, we'll have a box set up right outside the door. So we are having a little bit of a problem, and we expected this, with non-essential businesses continuing to operate. We've been getting calls all day. Again, I won't go through the entire list again, but if you are a non-essential business, you are strongly encouraged to stop your operation right now and close to the public. All right? We are trying not to go in and forcefully have people shut down, but if that's what it takes, that's what's going to happen. There are some case-by-case circumstances. We understand that, but for the most part, the list is pretty clear as to who is essential and who is non-essential. The only way the stay-at-home order is going to work is if people adhere to it. Stay off the roads if you don't have to be on the roads. Stay home if you don't have to be anywhere else. Also, it's causing an issue for employees who know that they're working at a non-essential business, but fear reprisal if they say something or step up. We want you to not put your employees in that sort of situation. There are some opportunities, some potential relief efforts for businesses. We want to continue reminding people to reach out to Lafayette Economic Development Authority. It's a great resource for information. At Lafayette.org, you'll find resources for businesses and resources for employees. Now, employees seeking unemployment benefits, guidelines to file have been loosened. It doesn't matter if you've been fired, quit, or laid off, as long as the reason for unemployment is COVID-19 related. Some of those loosened requirements include, under normal circumstances, employees wait a week before drawing benefits. In this current situation, you will receive a check the very next week. Also, requirements to search for employment while receiving benefits have been waived. For more information on filing for unemployment, go to Lafayette.org/COVID. That's Lafayette.org/COVID. Promise you, it's allergies. For businesses and employers, you can find resources, eligibility for SBA disaster loans and how to apply, information about tax relief, tax filing and payment information, and links to government agencies. An important note for contract workers and 1099 employees, you fall under the business category, not employee, but some of those unemployment benefits are going to, for the first time, be available for freelancers. LEDA has set up a link for employers and people searching for work. Businesses are hiring additional workers to meet demand during the pandemic. Find a list of employers at Lafayette.org/help-wanted. That's Lafayette.org/help-wanted. For those businesses that are still open, like restaurants and grocery stores, we want to urge you to use local distributors and suppliers. During this time, it's critical that we all do everything we can to keep our economy going as much as we possibly can. Buying and shopping local is one of the key things that we can all do to help. There have been some questions about the homeless. We're aware that some of those services for the homeless are limited. We're working to complete a compassionate plan and hope to have it in motion as soon as possible to deal with some of those issues. We have received some calls about the Salvation Army possibly being closed, but we were told that they are still open. So if you had questions about that. We've also gotten some questions about Lafayette Transit System. We are circulating fresh air through those buses as they go. There's, I forget the specific term, but there's air filtration and they are practicing social distance measures. We are looking at the 10-person rule, but at that point, we have to look at would it be feasible to still have transit if we had to limit each route to 10 riders. So we're practicing social distancing. They are being spaced out, adhering to that 6-foot rule, and we are going to constantly evaluate that situation. So with that, do you have any questions?
Can you expand a little bit on the situation with the pets going at the cage and dome? Was anyone bitten or anything like that?
Not that I'm aware of. Oh, thank you. The question was, yeah, I appreciate it. The question was expanding on the pet situation at the Cajun Dome screening site. Was anyone bitten? I'm not aware of anyone being bitten, but at the same time, we want to prevent that from ever getting to that point.
Can you provide more specifics on what the mayor-president is doing with trying to secure equipment?
More specifics on what the mayor-president is doing to try to secure equipment. He's, in fact, doing that. He's reaching out to different organizations, looking at what our possibilities are for federal and state aid, things along those lines. As far as what he's specifically doing at the moment,
Ventilators, masks,
everything. He is working with the local hospitals, with local office of the Department of Health, and working to make sure we have those things that we need. And of course, we all know nationwide there are not enough ventilators out there, so we're going to also be part of that group that really seeks to find more of those things, especially given the gravity of the situation here in the state.
what's the ratio of donations versus the amount of supplies that y'all are purchasing?
The question is, what's the ratio of donations versus the amount of supplies that we are requesting? I don't have a good answer for you on that right now. I can look into it, but right now we're just working to get whatever we can, however we can. Yes, ma'am.
For the Hispanic community, what type of, for the screening, what type of
That is a great question. I will look into that further, but as of right now, any sort of state or government issued ID, I will double check on passports if that's appropriate or any sort of travel documentation. Thank you. Good question.
The non-essential businesses that stayed open, were those reported to the police? How did you guys get aware of that, or people calling y'all specifically?
The question about non-essential businesses, were they reported to the police or were they reported to us specifically? Some were reported to us specifically. Some were reported to the police. Some we were able to resolve on our own by making a phone call. Some were referred to, I believe, the fire department, and the fire marshal's office did handle some of those calls. But as of now, we have not shut anyone down. We've just paid some visits.
Wait, and what was there a specific industry that was likely among them? Like, give us the profile of the typical business.
There were a variety of businesses.
Variety of businesses. Yeah.
And the question was, were there specific types of businesses that were in violation? I will tell you, we had some people call about some lawn services because they were concerned about that. Some different types of stores that sell specialty type things. Does that answer your question? Lawn services are allowed.
So clearly there's still some confusion about what's in and what's out. Like people were calling, maybe.
Well, I think if people would take a moment to go online and actually look at the list that we put out yesterday, there's a lot on there. And based on some of the phone calls, it seemed as though people had not actually gone through those lists and read. And the question was, is there still some confusion out there? Yes, there is still some confusion, but again, confusion that could be resolved by taking a look at those lists and the guidance we put out. Those lists can be found, I think, on. He asked where those lists could be found. I think on all of your websites, actually. Also on the LCG Facebook page. I want to say that they're on our website, but before this all started, our website was migrating to a new site, and that kind of just messed us up a bit. So we're working to get that updated. Also, 311, the website part of 311, I will send that out to you all. I don't want to tell you the wrong side at the moment. There's also a button that's been added that you can click to get COVID-19 alerts and updates and all the news that we've been putting out on a regular basis. So it's a good place for resources.
Several viewers have reached out to us saying that they realize the testing results for COVID-19, it'll take 7 to 10 days to come back. Now, in other areas here in Louisiana, they're starting to see some of those results come back in 48 to 72 hours, and our viewers are saying that the reason being that Lafayette Parish test results are taking longer because of the lab that they're contracted with. Is there any truth to that?
The question is, what is the holdup as far as getting test results from our Cajun Dome? And from the area is what you're asking?
Yeah, so we realize that here in Acadiana, it's taking 7 to 10 days.
Right.
In other areas such as Baton Rouge, we've heard that it's taking roughly 48 to 72 hours
Okay.
for those test results to come back, so they're coming back much quicker.
So viewers were saying that in Lafayette it's taking 7 to 10 days for test results to come back, but in some areas like Baton Rouge, they're coming back a lot quicker, 48 to 72 hours. I can tell you this, the labs that are authorized to be used are the same labs throughout the state. LabCorp, I know Mayo Clinic, Quest, there's a few others. Those are statewide available. I can't give you a specific reason as to what the holdup is or what the specific lag time is right now. I know the estimation was 7 to 10 days, but I can't tell you specifically what we've seen as far as the results we've gotten. I'm sorry. I'll come back to you, Neil.
Does the 311 number provide help in Spanish?
I know the answer to this. Yeah, got me on the spot there. If you dial 311, I believe someone there can provide Spanish interpretation, but I can double check on that for you. I know 211 also provides translation services, but I know the answer to that. It's just, it's escaping my head right now, but I'll get back to you. And the question was, does 311 provide language interpretation services? So we'll find out. Oh, I'm sorry, Neil.
Yeah, that's right. So today the governor said that he's been talking to hotels as sort of a third option to hospitals, should they be overrun? Have we talked to any hotels in the area to see if they could be converted to sort of monitor people who aren't the most in need of treatment for COVID-19?
All right, the question was, the governor, I guess, announced just now at his press conference that he was exploring the option of utilizing hotels as makeshift hospitals.
Yeah, sort of more like monitoring beds and staff.
Okay, as a medical place to monitor those. Gotcha. At this point, we are looking at our options when it comes to additional hospital space. We do not have a definite answer on that right now, but we are looking at what our options are. So I can't say that we've had contact or considered hotels at this point.
Do you have any information on how many COVID-19 patients are hospitalized here in Acadiana?
The question is, do I have any information on how many COVID-19 patients are hospitalized in Acadiana? I have as much information as you have that is listed on the LDH website. And that, I mean, that's the absolute truth.
Just a couple of quick update questions. This morning, did you guys run out of tests?
The question is, this morning, did we run out of tests? If we did, I was not told. I'm certain we had plenty of tests.
Sure. And, again, it's been indicated to you that we should expect the availability of tests to ramp up such that we can lower the threshold for who gets tested.
The question is, could we expect the availability of test kits to ramp up so we can expand the amount of people who get tested? And the answer is yes. That is the reasonable expectation by all of us at this point. As we go further into this and we realize that this is what it is, the federal government and the medical community is stepping up their efforts to manufacture and distribute those tests. So we are starting to see more and more of those come in. I don't know the specific number for you at this point, but we are actively seeking as well to receive some of those rapid read tests once those start, which should be here within the next week or so.
At this stage, no specific timeline. That's, I guess, what
I can't give you a specific timeline.
Is there any indication that we might be running out of PPE? That's why the mayor's out trying to secure some even more?
The question is there any indication that we might be running out of PPE? So the mayor's out securing more. I can tell you that we've seen an average of about 100 people come through the screening per day since we started the screening site. And it's not a matter of are we currently running out. It's a matter of if we sustain at this level, we will need a constant supply of those things coming in. So no, right now we're not out of PPE. But if we don't continuously replenish those supplies, we will ultimately run out. And especially considering that the medical community and the state is preparing for a continued increase in the amount of cases we have. I know the governor mentioned earlier this week that we have to act now or the state's hospitals will be overrun. Well, we're part of the state, and I mean, we're all in this together.
Did you have about like how much you're currently getting in a day since you're using about 100? You said you'll run out about how long do you think it's not changing?
Are you talking about test or PPE?
PPE.
Okay. The question was, do we know how much we have right now? Right?
Yeah, like if you don't get more, we'll run out in this long.
I can tell you that someone probably knows that. I was not out there this morning, and I haven't gotten any information on that. So, again, I'm not sure. Yes.
last question, I swear.
No, it's not.
There's been talk, I think, for about a week, maybe at the state level, where the governor suggested that we might look into refurbishing discontinued hospitals, for instance, in an effort to try and create more beds. I mean, have you heard of any specific plans to do that in Lafayette? I mean, I think of the Old Lord site that's just down the street. I mean, are we starting to look at that here?
You now have to repeat all this, right? No, the question was, are we looking at opportunities for perhaps refurbishing or reopening old hospitals or medical facilities in Lafayette? I can tell you that all options are on the table, and it would all depend on the feasibility of doing that and what sort of condition those buildings would be in. But again, that's not something that wouldn't be an option at this point.
So just to be clear, so you haven't specifically heard of a plan to do that, say, with the Lawrence site down there. You're just kind of saying in general, yes, it's on the table.
And what Lord site? That you're talking about the old site?
I'm not trying to pin it to that. I'm saying
No.
you're not aware of any specific plan, but the option is on the table.
But that hospital's gone, isn't it? St. Mary. Wasn't that demolished? The old Lord's Hospital?
There's still some of the buildings.
Right, those medical office buildings still remaining, but as far as the hospital campus itself, it's no longer there. Oh, okay.
You're just saying generally it's on the table, but you're not aware necessarily of any specific plan.
The question is it generally on the table or is there a specific plan? There is no specific plan at this point. Well, hello.
Today, the governor said that the early COVID-19 tests skewed more positive because they were testing people mostly in hospitals. Would you know if that was the case here in Lafayette Parish? It's weird. Most of our tests were going to people in hospitals.
The question is, did the governor mention something about early on testing was skewing positive because they were testing people in hospitals? Is that your question?
Most of the tests were coming out positive because most of the people being tested were already being treated in the hospital. Is that sort of similar to what we saw here?
We've seen 12 positive tests here, so to make that assessment wouldn't quite be fair at this time. I can tell you that if you look at the numbers of people that we have screened at the Cajun Dome versus tested, again, we are identifying those high-risk, symptom-showing people, that population. We are identifying them through the use of 311 and other methods prior to coming through, which is why you're seeing a greater number of people being tested there. But at this point, I can't say whether or not those tests are positive or absolutely will be. There's an assumption that many of them will be. And there's an assumption right now that a lot of people that are tested that show those specific symptoms, especially in those age ranges, are likely to become positive.
Is there any message of hope? We've heard about confirmed cases here, but we haven't heard a lot about people that have been tested and those results coming back negative. Do you have any of those stats? Is there a message of hope for our viewers, our listeners, our readers today?
I think there is hope. If you look at the total numbers of tests conducted in Louisiana, I believe the latest number was 13, little over 1,300 positive or close to 1,400. But we've also had over 8,000 tests that were administered. So for those, remaining, excuse me if I butcher the math, but 5,000 plus people that got negative results, I mean, there is some hope. Not everyone is going to be positive. Many people will be. But the good part is also, or the bright light at the end of the tunnel, is that a lot of us won't have symptoms if we do get ill. But unfortunately, some people will die as we're seeing that death toll go up. But we have hope in that the people here are smart. They're going to listen to what we're trying to do. Some won't, but for the most part, I know that there was a lot less people out and about, and it's a good thing that we're seeing the roads and some of these businesses quiet, because people are hopeful that this is going to work. I mean, City Hall is like a ghost town right now, but that makes me glad that people are actually taking this seriously.
Jamie, the governor said today he thinks that part of the reasons why New Orleans is a hotspot is Mardi Gras. Have any of our local cases been traced back to our local Mardi Gras events?
So the question was, the governor mentioned earlier that there's a good chance that a lot of the cases in Louisiana were tied to Mardi Gras, which is a common consensus at this point. Senator Kennedy also echoing those statements earlier on Fox News. Here locally, we don't have any specifics on any of the cases. We don't know ages, genders, residents. I mean, health officials are aware of that information. We as the government know nothing about that. So I can't give you a fair answer on that because I don't know. Any other questions?
Have you gotten any tests from Cajun Dome back?
The question is, have we gotten any tests from the Cajun Dome back? I'm not specifically aware if we have or not. And if we did, we don't know what the screening situation was for those tests. So that would be on the individuals if they do come forward and disclose that. But at this point, we don't know that, and I think it's unlikely that we would specifically disclose that.
And Jamie, yesterday you and I were talking because of an email that I received. Would you be able to stress for our viewers that have been tested just the process and how long it takes for them to get those results back, and who's going to be in contact with them?
And if I recall, it was someone who
was tested on Thursday, and they were curious about
right.
when they would be.
So Chris's question was, someone was concerned. They wrote to him. They were tested on Thursday. They hadn't gotten any results back, which today is Tuesday, if I'm not mistaken. So we've been saying 7 to 10 days. It hasn't been 7 days yet. When you get to the Cajun Dome, that's one of the reasons you also need to bring your IDs, because they're going to get your information off of that, your address. They should be getting your phone number. So make sure if you're going through the screening that someone has your phone number. And a doctor, a specific doctor from one of the hospital systems will call you with those results once they're received. It doesn't mean they're automatically going to be updated. It goes through that process first. The doctor makes contact with the patient. That information is then sent to the public health lab, and they compile those results. Good. Everyone good? All right. We will shoot for the same time tomorrow, pending any, the governor kind of picks different times each day, so we'll work around it. Thank y'all.